In this episode of the Courageous Public Health Podcast, Aaliyah Belk shares what it looks like to find your way in public health, even when you don't fully understand the path ahead. From navigating identity and learning how to take up space to asking for help and building her career without a clear roadmap, Aaliyah reflects on the courage it takes to keep going when you feel uncertain. This is a conversation about courage, identity, and growth, and what it means to stay the course in a field that doesn't always have clear answers. You're listening to the Courageous Public Health Podcast, episode 54. To all the courageous women leading in public health, this podcast is your space to turn up the volume on your courage. This space centers your voice. This space celebrates your passion. This space amplifies your courage. My role? To listen, to amplify, and to stand with you in the fight for equity. My name is Dr. Christy McClamrock. I am an epidemiologist, consultant, the founder and CEO of Courageous Public Health, and the host of the Courageous Public Health Podcast. Each week, I have real, unfiltered conversations with women in public health about the challenges you face, the power you hold, and your vision for the future. We talk about the authenticity, vulnerability, and courage that you bring, not just to public health, but to every part of your lives. Because courage is about action, even in fear. It's about taking up space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. If you're ready to turn up the volume on your courage, if you're ready to take up space, if you're ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, then listen to this new episode. Hello, and welcome to the Courageous Public Health Podcast. I'm Dr. Christy McClamrock. Over time, I've come to see something clearly. Courage is already everywhere in public health. It's just rarely named, supported, or treated as a leadership skill. Women are navigating complex systems, making high-stakes decisions, and finding their way in a field that doesn't always offer a clear path, even without the structures they need to do the work sustainably. Through Courageous Public Health, I partner with public health and other types of organizations to help shift that, supporting leaders to act with clarity and integrity, even when the systems around them are under pressure. Today's conversation is about what it looks like to find your way and to keep going, even when the path isn't clear. Aaliyah Belk is a project coordinator based in Atlanta, Georgia, and a public health professional with over 7 years of experience in human-centered programming, mixed methods research, and systems strengthening across national and global contexts. She holds a bachelor's in public health education and a master's of public health in health equity, social justice, and human rights. Most recently, Aaliyah served as a fellow at the CDC within the Division of Violence Prevention, contributing to national efforts addressing adverse childhood experiences, youth violence, and domestic violence. She also served as executive committee co-chair for the CDC Fellows Collective, supporting community and collaboration across fellows. Aaliyah was featured in Teen Vogue for her research and advocacy on reproductive justice for Black women, and she is passionate about using strategic communication and trauma-informed approaches to advance equity and accessibility in public health. Let's hear what courage looks like for Aaliyah Belk. Hi, everybody. I'm excited today to introduce Aaliyah Belk. Hi, Aaliyah. How's it going?
Hi, I'm doing well. How about yourself?
I'm good. I'm happy to be here with you.
Likewise.
Yeah, we connected on LinkedIn a little while back. And so this is the first time that I'm actually getting to talk to you and see you. So that's good. Yeah. It's good. So can you start by introducing yourself to our listeners?
Yeah, of course. So hello, everyone. My name is Aaliyah Belk. I am currently based in Atlanta, Georgia. I'm a project coordinator and been working in public health for the last 7 years. Started doing research my undergrad, like junior year of undergrad, and have been in a wide range of projects in different topic areas across the public health. And most recently was a fellow at the CDC and the Division of Violence Prevention, where I worked on a range of programs, national programs, working to prevent violence amongst youth, children, and domestic violence for adults. And yeah, I'm really grateful to be here, and excited to share more about my journey in public health and some of the vital work that I think is personal to me and to so many in this field.
Amazing. That's great. Okay, well, let's get started with the first question. So I always like to remind our listeners about bravery versus courage. So bravery is taking action without fear, while courage is taking action despite fear. So I would love for you to share some experiences from your professional life, your personal life, where you have acted courageously.
Yeah, well, I'll start with personal. I
Okay.
think that informs a lot of my decision making and kind of how I got into public health in the first place. So I grew up as a military brat, as we are affectionately called. My dad was in the army, and my mom is from Germany. So I grew up moving around every 2 to 3 years, which, you learn to be very independent, but also how to put yourself in different situations. And so that has given me a lot of, I think, courage to show up in ways that maybe I didn't think I could. And that part of my identity has really shown up a lot in my professional setting. So I grew up speaking German, and lived in Germany for some time and a couple other countries and a bunch of different states, and really got to learn a lot about different cultures and different just ways of living, thinking. And I'm really grateful for those opportunities because I think it lends really well to the world of public health when you're working in such diverse communities and spaces and being able to account for just different lived experiences. I think that is like at the core of the research I did and the work I did. And so also part of just my identity in general, being half black, half white in the context of the US and current political climates, thinking of, how do I take up space without taking over space, or like amplifying people's voices without my own voice being constantly at the center because of the narrative of who is favored in some of these spaces, is always kind of at the forefront of my mind. Um, and yeah, as I think through more of, kind of professionally how that has morphed and kind of blended into that. I think back to I was a transfer student. So I'll kind of walk through my undergrad
Yeah.
journey because it is also different.
Okay. Great.
Yeah, I started college wanting to be a nurse. I think that's kind of a common theme we hear amongst a lot of public health professionals is somebody wants to do health related. You just don't know what. And
Yeah.
nursing for me was kind of the first introduction and something that a lot of friends were doing, a lot of people in my life, had recommended I kind of take that path. And so started college with that in mind. I ran track at UNC Asheville my freshman year. I ran 400 hurdles, which was an experience, and quickly learned I was far too anxious, and it took a lot of courage to show up to practice every single day. It was my first,
Oh my
like my
gosh.
first introduction, um, to really having to practice being a courageous person. Waking up at 5 a.m. to go to weights was,
Wow.
while being a freshman in college and trying to stay on top of grades and be immersed in like the campus culture was definitely an experience.
I
But I,
no,
yeah,
sorry, I didn't mean to interrupt you. I just wanted to say that like hurdles is very impressive. It's that like you run up and then there's that moment of like, okay, I am now going to go over that thing. And I can just
yes.
imagine that there's a lot of fear. And also, yes, it takes a lot of courage to get over a hurdle.
Yeah. Lots of self-talk and trying to instill bravery, uh, because you fall a lot and you fail a lot, and getting back up and having to look
Yeah.
at the scars on your legs and just keep showing up to practice every day, knowing like it's me and this, the tunnel vision of me and this object
Yeah.
on this track. Um, Built a lot of mental fortitude.
That's
um,
great. That's fantastic. I love
yeah,
it.
yeah. And so I had started kind of, I call it my collegiate career academically and in the sports world, um, thinking I was going to go into nursing or potentially, something in that realm, maybe pre-med if I felt that matched what I wanted to do in the future. And then I had a course it was kind of like I don't recall what the program or the major that I had listed was. I think it was health and wellness or something of that nature. But I took a course and it was focused on public health. And I didn't know what public health was at the time. It was the first time I'd ever heard that term. And I instantly knew I like this is something that I want to do. I just don't know what it means. And had a really great introduction. We did a lot of community health in Asheville through my professor, Dr. Amina Batata. If she happens to ever see this,
Shout
I
out.
hope she does. Shout out to her because she truly like gave me the wording and just the vision to step into the field well before I actually ended up doing it. And so I ended up transferring after my freshman year because I no longer wanted to run track and they didn't have nursing. And so I was still feeling as if, I kind of needed to explore what was going on, what my future would look like if that was a path I really wanted to take. So I wanted as many options as I could. So I ended up transferring to the University of North Carolina at Greensboro. And another shout out because the UNCG Public Health Department, all of my professors, some are still there and some are no longer at UNCG, but I am forever grateful for the education and opportunities that they have provided me with and supported me through. I started kind of I transferred, I didn't know what I was doing. And I think luckily UNCG had a really strong transfer student population
Mm.
because it was a large commuter campus. And so I was able to kind of find a little bit of community and started talking to the counselors or the admissions folks who helped kind of navigate you like what courses to take and things of that nature. And from there I'd had a meeting with an academic advisor is the word I was looking for, but with an academic advisor, and it was not as positive as I wanted it to be. It was really um, I was convinced not to apply to their nursing program because I wouldn't be as competitive. Because I'd taken statistics my freshman year while also running track in like my first semester of college, and I got a C. I
Mm.
think I had a C minus, so it didn't transfer. And so I had to retake it over the summer, but I got an A and I was really proud. I taught myself how to do a college level statistic course all by myself
Amazing.
over the summer
Yeah.
going into like my sophomore year of college. And I was like, I can do anything. If I can do that and get an A, I can do anything. But it kind of left me with a sour taste in my mouth because I was really excited about kind of looking into that journey of
Yeah.
nursing, and to be met with not positive feedback didn't, I did not practice courageousness in that moment. I stepped back and I was like, okay, I won't do it. If if I can't be great at it, why would I do it? And so from that moment, she had mentioned public health, physical therapy, and the other programs that UNCG offered, and did a lot of digging, lots of googling, and ended up applying because you had to apply at my school to join the public health like major and declare it. So I took like an intro course that they offered and was immediately in love and knew this is exactly where I was meant to be. An interesting way to get there, but it is exactly where I want to be and where I need to be. And so from there was a lot of practicing courage. I still didn't know what I was doing. I still didn't know who to reach out to, what areas of public health I was interested in, what I could even do with a degree. I was lost. I didn't have anyone in my family in public health. And so I sat in a class that I had that wasn't public health related. I think it was similar to like health coaching. And we had a speaker come in, and she was a master's student, I believe, at the time in the public health program. And so I stopped her after class and I was like, "Can you please help me? I'm so lost. I have no idea, what research is. What you're doing sounds really interesting and really important, and I really want to get involved." So it was my first, I think, act of courage towards building my career.
Yeah.
And I'm so grateful to her because she introduced me to my mentor in undergrad, Dr. Tracy Nichols. And from there, I was included on a lot of different health projects, and I got to do a lot of research. And I was a McNair scholar while I was an undergrad. And I just, I took a leap of faith in that moment, totally afraid that I might fall flat on my face and not know where, if this investment in my education was going to build anything for me other than just being an interest, because it didn't feel like it had like a tangible outcome. Like there wasn't like a title that I felt like I would have. Whereas like being a nurse, I was like, I'll just be a nurse.
Right.
Like when I'm done with this degree, I'll have a job because I'll just go to a hospital and
Right.
someone will hire me.
And everyone knows what a
Um,
nurse does. I
yeah,
love that you said, like, I didn't know what I was doing. I didn't know what it was. I just knew that it was like, I really wanted to do it. I really want to do it, but I don't know what it is. And I feel like
yeah,
a lot of people in public health are going to be able to relate to that. It's like, there's something in your body that literally says like, yes, even
yeah,
before you fully understand all that public health
exactly.
is, because it's so many things. It's like,
hmm
it can do so many things.
It is, and yeah, that is something I'll touch a little bit on it, but just something in public health that I hope more people know about public health as things continue to develop, is that I think public health is such a multifaceted degree and program that can give you a wide range of skill sets that I think are invaluable. There have been times where I've contemplated, why did I study public health? Like I don't know what I'm doing. I feel lost. I feel confused, especially because I started my MPH right after undergrad, I graduated in 2020, in the midst of the onset of the pandemic,
Yeah.
and that that process was really difficult. I felt really isolated in my degree and just like my interests. I didn't know how to navigate grad school because I didn't really have anyone. Everyone was, because of COVID, it made it harder to connect with people because people are surviving. People are trying to get through every single day. And so I it was just trying to figure out what to do. My undergrad and my grad school experience were very different. I felt incredibly supported, and I had such amazing opportunities, and the faculty really poured into me, and I really poured into the work I was on. And then, obviously, because of the state of the world at that time, it all transitioned into something very different. And then I got to grad school, and it is a lot more independent and kind of hands off. You have to really seek out opportunities. And I felt like I was not in the mental space to put myself out there in that way because I was questioning every day if this is the right thing for me to do at this time. Like, am I prepared? Because a lot of the students in my cohort were not a lot older than me, but they had a couple years of experience in, working in organizations or working just in the field. And then they came back to do the program. So
Yeah.
they had, a foundation and support. And I was just, this like student fresh out of undergrad thinking like, oh my gosh, I'm going to change the world. And very quickly realizing I don't know what I'm doing. I feel lost. I feel like I'm drowning, and all these classes, I'm learning so much, but I'm like, I don't know how to act on the things I'm doing because I'm not in the same environment that I was in my undergrad institution.
I can really relate to this, what you're saying. Um, I went all the way straight through and started a PhD program at the University of Michigan. And when I was
Mhm.
studying for the qualifying exams, I realized that the other people who were also studying for the qualifying exams, they had all worked in public health. And I had not. I had done my internship for my master's program, but I had never had a job in public health. And it wasn't that I didn't think I could pass the qualifying exams or like academically do the piece, but I was like, I just haven't been out there. So I actually ended up dropping out of that program, and I went and I worked at Michigan Department of Community Health for a couple of years in HIV surveillance. And then I went and got my PhD at UNC Chapel Hill. So so I completely understand what you're saying. Like there is this, it helps to have a little bit of experience. I think it
Yeah,
does.
it does. I think it also shapes, the opportunities that you're aware of. I think I was in a much smaller cohort in my concentration area. There's only 15 of us, and it was just more difficult, I think, for my experience because I just felt very unaware of the resources on campus, coupling that with it being during the onset of
Yeah,
COVID
yeah,
and nobody's on campus, so you're emailing people who are being bombarded with emails. So it was a lot of, I'm just eyes closed in the dark. I feel like I'm just trying to find something to touch and grab onto. And
yeah,
whatever that is, I'm just going to write it out until I can figure out where I'm going.
yeah,
And that kind of carried me through. And, looking back on it, I'm grateful that I was able to stay the course and complete the degree, but it was really hard. And I think
yeah,
if I were to do it all over again or encourage, somebody that asked me what would you like recommend if there's an opportunity to gain work experience,
yeah,
I would do it. And if you can do it while you're doing your program, then
yeah,
I would definitely do it. I mean, I worked as a research assistant part-time
yeah.
on two different projects while I was in my master's program, but also had the thought of dropping out and I started interviewing for jobs into my second year because I was like, maybe I do need more experience before I finish this degree to make sure this
Yeah,
is really what I want to do.
yeah,
This is a big financial commitment,
yeah,
but I'm grateful for that process. I think it also helps
yeah.
change how I view things.
I mean, in the end, some people go straight through without and don't have the work experience, and some people have the work experience. And I think, you know, there are no right or wrong answers, right? Like you could totally make it work.
Exactly.
It's just deciding what makes the most sense for you.
Hmm.
But yes, I certainly appreciate that. That is can be a big consideration for people, and part of it is just like you're saying, like you didn't even really know what public health is, and one of the ways to really understand what public health is to get out there and do public health.
Exactly.
Yeah, yeah, that's great. Thank you for sharing that, and lots of examples of courage in what you shared, and I thank you for sharing the piece around your identity and your racial identity and sort of how that's guided you through your professional journey, like your personal journey and your professional journey.
Yeah.
I appreciate that
Yeah.
very
Yeah.
much.
It's definitely shaped a lot of the research interests that I had. I was very much tapped into the global health aspect of in undergrad. I was able to go abroad with a professor on a 2-week study abroad trip to Thailand to learn
Oh,
more about refugee processing and kind of, what it looks like in a global health context policy wise, because there was at UNC Greensboro, the Center for New North Carolinians. So they did a lot of work in the community, and my program was very community health focused. So I did a lot of work in the Greensboro community with a large um, a large group of people who were coming in either from um, Vietnam or all these other countries, and helping them navigate and figure out what resources are available to them. And so having that experience again with my own personal background and living in different countries and just in general being a very curious person and wanting to connect with as many people as I can, that really helped inform the research I did. So I always was very mindful of, my own identity in the process of doing research. And I did a lot of research that I never published, but because it was COVID. So I didn't get to publish my paper, and it just it fizzled out. I lost the motivation, but I had started doing work, some research looking at attitudes on advocacy and activism in reproductive justice, and largely started out as looking at women of color, just trying to capture the whole pool of, people who are going through this experience, and quickly realized I can't be the voice for everyone. As much as I want to be able to write all of this in this paper, I have to kind of figure out what area I can, that one that is of relevance to me because of my own lived identity and my own lived experiences, and who I have access to in my network that I can interview, and share stories and amplify their voices. And it, as that process went on, slowly dwindled down into just focusing on Black women in my community and looking at, the maternal mortality rate, and doing a lot of research focused on attitudes on activism and advocacy and policy, because that was my specific interest, was how do we talk about issues and how do we make change and create solutions without, always being at the table, or without ruffling too many feathers so that it gets taken away. And like the buzzword around health equity at the time was also a really great interest of me, but it was, yeah, it was really important work to me at the time. And of course, how I show up and how I'm perceived really impacts how I approach the work that I do.
Yeah. So I've got to ask you about the piece that you wrote for Teen Vogue.
Yeah.
Tell us about that, because I think that's related to
Yeah.
what you're, talking
Yeah,
about.
so I actually I was profiled for Teen Vogue. I had been I saw something on Twitter at the time, and a friend had nominated me to the writer of the article. And so she reached out and we talked a little bit about the work I was doing, because I felt it was relevant to the conversation. She was looking for advocates and activists, young female advocates and activists in the space, doing work in the global South largely. But in general, she's trying to find people who are committed to doing the work. And we had a really great conversation. And I told her I felt like, I guess I was having imposter syndrome, because I felt like maybe the work I was doing and my interests weren't important enough in the context that she was looking for. So I
Mm-hmm.
was like, everyone's doing this really great work with organizations that they're paired with. And I feel like I'm being a researcher and I'm like in this little silo, but I'm trying to move that work into the public for people to have more conversations and contribute to the already extensive area of research and just topic area of this. And so through that conversation, it was a really great opportunity to talk to someone who is also well versed in the area of activism and just looking at advocacy through a lens. She does a lot of work with music and advocacy, which I thought was a really
Oh,
interesting
yeah.
conversation, just like community healing through like dancing. And so
Nice.
that was a really great conversation. And I feel like she gave me a lot of inspiration to continue doing the work, because it is important. I think sometimes you work on things and you feel like I'm just another voice, and especially when you're operating in research and you're just like you're doing your own little thing. Um, it was nice to be reminded that there are so many people doing the work and in so many different ways, and they're taking so many different avenues to do the prevention and to do um, the kind of boots on the ground work that everybody wants to kind of rush past to get to the outcome and to share. Here is the evidence-based practice that we have. This is how you fix it, but what about the process to get there? And so, yeah, that was a bit of the work that she had highlighted, with some of the advocacy work and organization that I had picked up some of my skills and training and education through.
It's a very cool thing to have on your CV. And it's really cool that that's something that they wanted to highlight in their magazine for
Yeah,
teens. I mean, I'm impressed by that. That's really
yeah,
cool.
yeah, yeah.
Yeah. So, okay, I want to ask you a little bit more about being in spaces where your authenticity and your power and your courage are maybe not always welcomed. And I'm wondering if you have some thoughts about how you kind of express and embody your courage in those types of spaces, and if you've had some challenges around that, like what kind of strategies have helped you navigate them?
Yeah. I think this question makes me think a little. Um, I
Good.
feel I feel like because I picked a lot of the spaces that I was in or kind of just found myself in spaces, I haven't had as many challenges. Also because I'm still quite early, like early mid-career, I haven't had as many, I guess, direct challenges with the work or research or topic areas that I'm interested in being met with anything other than support, which I feel grateful for, but also realize like that is not the full reality of working
Sure.
in public health.
Sure.
And so that's something that I think I'm kind of bracing for is what happens when I'm in these situations. I think the most I've felt that way was at when I was a fellow at the CDC. This was my first time working really outside of academia and like a student role
Yeah.
and doing research. So it was the first time, where I'm working for the on behalf of the federal government
Yeah.
as a fellow because um, I wasn't an employee of CDC,
Yeah.
um, but working in the system and in there with all of the rules and things that come with that was the first time where I really thought about how do I show up for myself and for my community when we have these conversations because I had started in October of 2022. And so there was similar to what we're going through now, conversations of no longer being able to use health equity and certain words that had to be pulled. And so how do we talk about health in a way that is all encompassing and is still truthful because words have power and they mean things.
Mm-hmm.
So how do we talk about these things without jeopardizing large, you know,
Yeah.
having large consequences for trying to be truthful
Yeah.
to words that have meanings and words that are important and provide a lot of context for why things exist the way they do. And so that was, the first introduction to how do you like hold on to the power of that word because it also is charged from my own identity and my own lived experience and the lived experience of the nation and people that we're trying to do work on behalf of to help them was certainly that first introduction to showing up and I say like a challenge I guess for my own personal journey. But even within that, I think all the teams that I've been on while I was at CDC were incredibly supportive and encouraging and very reflective of, being in a space where people will empower you and also, see the good that's being done and are very mission driven. And I think that was and so far in my journey, it has been really helpful. But it's certainly something I think about as I'm continuing on in my career and no longer in that environment because it was
Yeah.
a really special environment to be in.
Yeah. I mean, the idea of talking about health equity without talking about health equity is like, we're not going to not talk about health equity. So,
Yeah,
you know, yeah, that still blows my mind. It still blows my mind.
yeah.
But you know what? We care about health equity in public health. And so we figure out how to talk about it.
Yeah. I mean, yeah, even now, the challenges of
Yeah.
my master's in public health as a concentration in social and health equity, social justice, and human rights. So even having to the last few months while I was at the CDC, having to be worried that that alone would be a red flag and jeopardize
Yeah.
anything happening just because my name was attached to it was something that I really internalized and, was not a good feeling
Yeah.
because you don't want it's a title. It's something that does exist. And there's lots of lots of scientific evidence and proof that it does. And
Yeah.
it's something that should be addressed because it saves lives. We have to talk about the discrepancies in our systems that where we have to bridge gaps in order to give people the care and access and quality that they deserve.
Yeah. I think when it's something that we care about so much, and like you're saying, this is literally part of your degree, like this is part of you. And then to have systems say to us that can't, like, we're going to deny that that even exists. It's like denying that a part of you exists or that something really
Exactly.
important to you exists. And that's a pretty heavy emotional weight, I think, for people that I don't know how much that's been acknowledged, right? The sort of the personal impact for people in public health of the sort of denial that health equity is a thing or that it
Yeah.
matters. It's like, and I mean, obviously for people who, yeah, I don't want to even, we'll cut that out. But that's
Yeah.
tough. That's tough.
Yeah.
Well, Aaliyah, I am very interested to hear about your vision for the future. And I'm thinking about your vision for public health, your vision for your communities or community, your vision. Let's say that again. Your vision for your community or communities, and also your personal vision for your own future. What's next for you?
Yeah.
Yeah.
Yeah. Trying to stay hopeful, I think, is at the top of mind for my future. I think, as many feel, it's just been a difficult year now, um, in the world of public health, and I'm looking forward to the continued efforts that people are, that we're putting in and to doing the work, even though it feels so much harder than it may have felt before. And my hope is that more people don't stray away from public health, given, I've seen lots of discourse online and on TikTok about people being in their MPH program or studying public health and like, I need to pivot, I need to do something completely different. And I hope that people do stay the course
Yeah.
because we will absolutely have to rebuild, what has been lost and altered. And I think in a weird way, because I hate to say that, but it feels exciting to
Yeah.
change things.
We
I
get to.
think
We get to rebuild.
yes,
We don't have to rebuild. We get to
yes,
rebuild. Yeah. Yes. I
exactly.
agree with you that it
Yeah,
feels exciting in the midst of all the other more difficult feelings.
yes, exactly. And I think that's something that I try to remain hopeful on is that the future is ours and we have the ability to shape it the way we want and to have as much impact and as much innovation that we can in the next however many years it
Yeah.
takes.
Yeah.
But that, there are a lot of people who are committed and mission driven to doing the work. And a lot of public health work, I think, is also just so much of it. I think my general hope for the future is people are more aware. I think during COVID, people were starting to get it. And along the ways, we lost some folks
Yeah.
in
We
the
did.
train of thought and understanding, why this work is so important. But I
Yeah.
think so much of it is also done behind the scenes and it's been effective and it's working
Yeah.
because it's working. Like, you don't
Right.
have to hear about it every single
Yeah.
day because you know it's working. We wear seatbelts.
Yeah.
We there's smoking and non-smoking areas,
Yeah.
so many everyday things that people don't think about that are public health solutions. I think unfortunately we'll continue seeing some of the fall, like the rollback, I guess, of it.
Yeah.
And I think people will become more, my hope is people will become more aware and take more concern and,
Yeah.
oh my gosh, like I can't believe that this is what it looks like now. Like we had this thing.
Yeah.
How do we get it back? What do we do? And how can we do it better?
Yeah.
Is my overall hope for the future and what the vision of public health will look like. And I think personally for me,
Yeah.
that just it looks I think my current area of like hyperfixation in public health is on health communications because I think, my experience at CDC, like kind of off the heels of 2020 and being there in 2022 and being there up until late last year is is communication is incredibly important, and a lot of work was being done and can continue to be done, and now it has to look different than it did before,
Yeah.
because now we're in a very different scenario, and that's an area that I'm excited to like dive deeper into, whether it be starting a DRPH program or a PhD in the near future. Just some things that I'm excited about building out and contributing to, because I think there's a lot of overlap in the work that has already been done, and again, just excited about what is to come.
Yeah.
What can we do to not wallow in this? Because I
Yeah.
feel myself doing that every day, like being really upset and sad, and trying to put my energy, and which is also a very privileged thing to say, but trying to put my energy into thinking about what I can do to move the work forward and keep building community and showing up and doing things that, that don't discourage me.
Yeah. Yeah. I think that it's really important to try to hold on to some positive perspective on, the opportunities that we have to make things better than they were before. Because it's not like there were a lot of problems with the public health system that we had before it, got dismantled in such a dramatic way.
Yeah.
So let's build something even better. I think it is exciting. And yes, I agree with you that there is saying that does come with some amount of privilege, right? Like we can say that because there's some amount of privilege, but also that's what I think helps people keep moving forward. And yeah, that's great. That's a great vision, and I'm excited to see where your career goes from here.
Yeah.
Yeah,
Thank you.
exciting stuff. So I want to make sure that our listeners know the best way to connect with you.
Yeah. The best way to connect with me is on LinkedIn. It'll be my first and last name.
Okay, great. And we'll put that the LinkedIn link in the show notes. And so it'll be easy for people to reach out to you in that way. So
Yeah.
thank you so much. It's been a real pleasure. It's I'm excited for you. I'm excited for you and your career moving forward.
Yeah. Thank you. And thank you again for having me.
Absolutely.
Glad that we finally got to talk.
Absolutely. Yeah, my pleasure.
Sometimes courage is asking for help, even when you don't know what you're doing. Sometimes courage is staying the course, even when the path isn't clear. Sometimes courage is learning how to take up space without taking over space. Aaliyah Belk reminds us that you don't have to have it all figured out to move forward. You just have to be willing to take the next step. If this conversation made you think about the women on your team, your organization, or your own leadership, this is exactly the work we do through Courageous Public Health. We partner with organizations to offer facilitated, interactive virtual workshops for women leaders in public health, turning courage into a leadership skill so it can become an organizational strength. Because in today's public health landscape, fear-based leadership costs organizations staff retention, community trust, and their ability to respond when it matters the most. Interested? Reach out. Links to connect with us are in the show notes. Until our next episode, stay courageous. Thank you for listening to the Courageous Public Health Podcast. Visit courageouspublichealth.com to find the show notes for each episode and learn how to connect with us.